Ohio voters enshrined abortion rights into the state constitution more than 2 years ago, yet the abortion debate is heating up again.
State lawmakers introduced a bill that would stop doctors from mailing the abortion pill and would restrict telehealth.
Columbus Bureau reporter Morgan Trout has been covering this topic since before Roe v. Wade was overturned in 2022. She brings us the latest tonight in this fight.
Medications delivered right to your door.
People don't have to say, well, I have to take off work to go to the clinic. I can get it by mail. I can do this when I want to.
Since 2024, Ohio's 13 abortion clinics have been able to prescribe the abortion pill during video visits with patients and even mail it directly to homes. At the Northeast Ohio Women's Center, Dr. David Burkon says 2/3 of his patients have a medication abortion versus surgical.
It's on their schedule rather than ours, which obviously has a lot of appeal.
But that form of access could be restricted soon.
Mail order medications have become much more commonplace. And this is a good, common sense, generally applicable bill.
State Rep Adam Matthews introduced House Bill 324, which would prevent mail order prescriptions and telehealth appointments for medications that cause severe adverse effects in more than 5% of users. Anti-abortion groups that testified in support of the bill cite a study done by a right-wing think tank that lists mifepristone, the most common abortion medication, as having severe impacts on 10% of patients.
If these medications are sending any patients to the hospital with sepsis, organ failure at a rate of 1 out of 20 patients, then I think that should be the cause of concern.
Burkons points to plenty of studies that say that the meds are safe. He also says that the legislation is unconstitutional. In 2023, voters overwhelmingly protected access to abortion.
They're letting politics get in the way of health care.
When we questioned, Matthews said that this wasn't meant to target abortion, as it applies to various classes of drugs like antidepressants and opioids. The Ohio Department of Health would decide which drugs meet that 5% threshold.
Looking at the Department of Health, insurance claims, and the self-reported studies that a drug manufacturer puts out.
The bill would require in-person appointments at one of the 13 clinics to get the abortion pill, which Burkon says will reinstate barriers to care.
They're trying to say we know more than the women do, so therefore we're going to make it more difficult or impossible for them to access this very, very efficient method of healthcare.
It's still early in the hearing process, but progressive advocates say that they're prepared to sue if the bill goes through. At the Ohio State House, I'm Morgan Trout reporting.